concussion evaluation and management. The VOMS exam should be used in conjunction with other concussion evaluation tools such as symptom scoring, understanding of previous medical history and concussion history, and neurocognitive testing. It should never be used as a standalone assessment. The VOMS is designed for use in patients age 9 to 40. When used with patients outside of this age range or immediately following injury, interpretation may vary.
Prior to starting this examination, it is important to ask about the patient's baseline symptoms. In this case, baseline is prior to the assessment, not prior to concussive injury. Symptoms queried should be headache, dizziness, nausea, and fogginess on a scale of 0 to 10. Abnormal findings or provocation of symptoms with any test may indicate neurologic dysfunction.
The Smooth Pursuits evaluation tests the ability to follow a slowly moving target.
All right, I'd like you to watch my finger, and I'm going to watch your eyes. Keep your head perfectly still. Now I'm going to ask you to rate your symptoms on a scale of 0 to 10, 0 being none, 10 being the worst.
The examiner will test the ability of the eyes to move quickly between targets.
I'm going to want you to look from one finger to the other with your eyes only. Keep your head still. Move your eyes as quickly as possible as you move from target to target.
The exam convergence measures the ability to view a near target without double vision.
Hold this stick at arm's length, focus on the target there, the X, and I want you to slowly bring that towards your nose. When you see 2 of the X's, 2 of that target, I want you to stop, and then I'm going to measure the distance from the stick to your nose.
A normal score for convergence is 6 centimeters or less. If you notice any outward deviation of either of the patient's eyes, have the patient stop moving the target and measure at that. Accommodation measures the distance one experiences blurriness and is measured one eye.
Cover one eye, extend your arm out and focus on the target. It's clear now. I want you to tell me when that gets blurry. Bring it in slowly.
No.
Or vestibular ocular reflex assesses the ability to stabilize vision as the head moves.
Now I'm going to have you focus on the target. When I start the metronome, I want you to move your head from side to side, keeping your eyes focused on the target. We're going to do 10 repetitions. Good.
This exam assesses visual motion sensitivity and the ability to inhibit vestibular-induced eye movements using vision.
Extend your arm and focus on your thumb, and then you're going to extend it out straight, and you're going to rotate your whole torso from side to side, 80 degrees to either side. You want to move as if your head, your arm, and your trunk are all in one unit. I want you to start when the metronome starts. You can do 5 repetitions.
As with the preceding tests, assess headache, dizziness, nausea, and fogginess on a scale of 0 to 10.
Good. I'm going to ask you to rate your symptoms again.